Pharmacokinetics Part 1. Pharmacokinetics is derived from two words, pharmakon meaning drug and kinesis meaning movement. In short, it is what the body does to the drug. It includes absorption, distribution, metabolism, and excretion. All these processes involve movement of the drug molecule through various biological membranes. All biological membranes are made up of a lipid bilayer. Drugs cross various biological membranes by the following mechanisms. First, passive diffusion. It is a bidirectional process. The drug molecules move from a region of higher to lower concentration until equilibrium is attained. The rate of diffusion is directly proportional to concentration gradient across the membrane. Lipid-soluble drugs are transported across the membrane by passive diffusion. It does not require energy. Second, filtration. Filtration depends on the molecular size and weight of the drug. If the drug molecules are smaller than the pores, they are filtered easily through the membrane. Third, specialized transport. A. Active transport. The drug molecules move from a region of lower to higher concentration against the concentration gradient. It requires energy. Example, transport of sympathomimetic amines into neural tissue, transport of choline into cholinergic neurons, and absorption of levodopa from the intestine. B. Facilitated diffusion. This is a type of carrier-mediated transport and does not require energy. The drug attaches to a carrier in the membrane, which facilitates its diffusion across the membrane. The transport of molecules is from region of higher to lower concentration. Example, transport of glucose across muscle cell membrane by a transporter glute. Drug absorption. The movement of a drug from the site of administration into the bloodstream is known as absorption. Factors influencing drug absorption. First, physiochemical properties of the drug. A. Physical state. Liquid form of the drug is better absorbed than solid formulations. B. Lipid soluble and unionized form of the drug is better absorbed than water soluble and ionized form. C. Particle size. Drugs with smaller particle size are absorbed better than larger ones. Example, microfine aspirin, digoxin, and griseofulvin are well absorbed from gut and produce better effects. Some of the antihelminthics have larger part size. They are poorly absorbed through gastrointestinal tract. Hence, they produce better effect on gut helminths. D. Disintegration time. It is the time taken for formulation, tablet or capsule, to break up into small particles, and its variation may affect the bioavailability. E. Dissolution time. It is the time taken for the particles to go into solution. Shorter the time, better is the absorption. F. Formulations. Pharmacologically inert substances like lactose, starch, calcium sulfate, gum, etc. are added to the formulations as binding agents. These are not totally inert and may affect the absorption of drugs. Example, calcium reduces the absorption of tetracyclines. Second, route of drug administration. A drug administered by intravenous route bypasses the process of absorption and it directly enters the circulation. Some drugs are highly polar compounds, ionized in solution and are not absorbed through GI tract, hence are given parenterally. Example, gentamicin. Drugs like insulin are administered parenterally because they are degraded in the GI tract on oral administration. Third, pH and ionization. Strongly acidic, example heparin, and strongly basic, example aminoglycosides. Drugs usually remain ionized at all pH, hence they are poorly absorbed. Fourth, food. Presence of food in the stomach can affect the absorption of some of the drugs. Food decreases the absorption of rifampicin, levodopa, etc. Hence, they should be taken on an empty stomach for better effect. Milk and milk products decrease the absorption of tetracyclines. Fatty meal increases the absorption of griseofulvin. Fifth, presence of other drugs. Concurrent administration of two or more drugs may affect their absorption. Example, ascorbic acid increases the absorption of oral iron. Antacids reduce the absorption of tetracyclines. Sixth, area of the absorbing surface. Normally, drugs are better absorbed in the small intestine because of the large surface area. Resection of the gut decreases absorption of drugs due to a reduced surface area. 7. Gastrointestinal and other diseases. In gastroenteritis, there is increased peristaltic movement of the drug of movement that decrease drug absorption. In acholhydria, absorption of iron from gut is reduced. In congestive cardiac failure, there is gastrointestinal mucosal edema that reduces the absorption of drugs. Bioavailability. It is the fraction of a drug that reaches systemic circulation from a given dose. Intravenous route of drug administration gives 100% bioavailability as it directly enters the circulation. The term bioavailability is used commonly for drugs given by oral route. If two formulations of the same drug produce equal bioavailability, they are said to be bioequivalent. If formulations differ in their bioavailability, they are said to be bioinequivalent. Factors affecting bioavailability. The factors which affect drug absorption, physiochemical properties of the drug, route of drug administration, pH and ionization, food, presence of other drugs, area of absorbing surface, gastrointestinal and other diseases also affect bioavailability of a drug. Other factors that affect the bioavailability of a drug are discussed as follows. First pass metabolism. First pass effect, pre-systemic elimination. When drugs are administered orally, they have to pass via gut wall, portal vein, liver, systemic circulation. During the passage, certain drugs get metabolized and are removed or inactivated before they reach the systemic circulation. This process is known as first pass metabolism. The net result is a decreased bioavailability of the drug and diminished therapeutic response. Example drugs like lignocaine, isoprenaline. Consequences of high first pass metabolism. Drugs which undergo extensive first pass metabolism are administered parenterally. Example like lignocaine is administered intravenously in ventricular arrhythmias. Second, dose of a drug required for oral administration is more than that given by other systemic routes. Example nitroglycerin. Second, hepatic diseases. They result in a decrease in drug metabolism, thus increasing the bioavailability of drug that undergo first pass metabolism. Example propanol and lignocaine. Third, enterohepatic cycling. It increases the bioavailability of drugs. Example morphine and doxycycline. Drug distribution. Distribution is defined as the reversible transfer of drugs between body fluid compartments. After absorption, a drug enters the systemic circulation and is distributed in the body fluids. Various body fluid compartments for a 70 kg person can be depicted. Redistribution. Highly lipid-soluble drugs such as thiopentone on intravenous administration immediately gets distributed to the areas of high blood flow such as brain and causes general anesthesia. Immediately within few minutes, it diffuses across the blood-brain barrier and into the blood and then to the less perfused tissues such as muscles and adipose tissue. This is called redistribution, which results in termination of drug action. Thiopentone has a very short duration of action, 5 to 10 minutes, and is used for induction of general anesthesia. Blood-brain barrier. The capillary boundary that is present between the blood and brain is called blood-brain barrier. In the brain capillaries, the endothelial cells are joined by tight junctions. Only the lipid-soluble and unionized forms of drugs can pass through BBB and reach the brain. Example: barbiturates, diazepam, volatile anesthetics, amphetamine, etc. Lipid-soluble and ionized particles do not cross the BBB. Example: dopamine and aminoglycosides. Biotransformation. Chemical alteration of the drug in a living organism is called biotransformation. The metabolism of a drug usually converts lipid-soluble and unionized compounds into water-soluble and ionized compounds. Prodrug. It is an inactive form of a drug which is converted to an active form after metabolism. Pathways of drug metabolism. Phase 1 reaction. Oxidation. Addition of oxygen or removal of hydrogen is called oxidation. It is the most important and common metabolic reaction. Phase 2 reaction. Phase 2 reaction consists of conjugation reactions. If the phase 1 metabolite is polar, it is excreted in urine or bile. However, many metabolites are lipophilic and undergo subsequent conjugation with an endogenous substrate, such as glucuronic acid, sulfuric acid, acetic acid, or amino acid. Factors affecting drug metabolism: age, diet, disease, genetic factors such as slow and fast acylatators of isoniacids, succinylcholamine apnea, glucose 6-phosphate dehydrogenase deficiency, and hemolytic anemia. Simultaneous administration of drugs.